Good morning and welcome to this fourth day of the GPS Navigation for Caregivers Conference. My name is Rob Fabian with Age of Central Texas, and we are very honored that the Riverbend Church asked us to join with them this year to bring you this 8th annual conference for caregivers. This is our first year that we've done the conferences virtual, and we are so glad that you're joining us this morning because we've got some incredible information to help you in planning for long-term care. We all know it's not an if, but when that comes to our lives. And so we're going to talk about information that you need to know to get yourself ready for when that happens. The Riverbend Church has been producing the conference now for 8 years, and it's my pleasure to introduce Sharon Butler with Riverbend Church. Sharon's going to give us some information about the conference itself, about the church, the great things the church has coming for the community. And so, Sharon, I'll ask you to unmute, and I will throw it to you to fill us in on all that great information.
Thank you, Rob, and good morning. On behalf of Riverbend Church, I'd like to welcome you. I'm so glad that you are able to join us today. I hope you've been able to catch some of the other great sessions that we've had this week. It's been amazing. We have such a wealth of information and professional network in our community that are available for you and to help you on this difficult journey. And it's always been such a pleasure to bring this together. 8 years ago, I gathered a group of other family caregivers that were in need of information and resources, and we started putting this together, and it's been a great trip for 8 years, and doing it virtually has been really a lot of fun. I didn't know if I could do this, but Rob has done all the technical stuff, has done a wonderful job. So thank you, Rob, for that. And I would love to welcome and thank Natalie with Turnkey Transitions, who is our presenting sponsor. We appreciate your participation every year and welcome you. And Paul Clark with Buckner Villas, who's sponsoring our session today with Lina Supnet-Zapata. So just as a little bit of information, at Riverbend, we have a great support group going for family caregivers. It meets every week. And hopefully the end of this year, we'll be starting a once a week free respite program for care partners and their loved ones. So if you're interested in either one of those things, the information and the contact information will be in your online program that we'll get out today. Rob, is that right? And also on the survey that we'll be sending out on Monday, if you would like us to contact you and help you get through information about those things, we'd be happy to do that. So if you don't mind, I would like to start with a prayer this morning. If you'd like to join me. Father, we thank you for the opportunity to gather this way, to learn what we need to be better caregivers and to do our job well. It's a hard road, and you know that we're all doing the best that we can. And today, as we learn about the financial impact of long-term care and how to stretch our resources, help us to find some nuggets of great information that can make this job a little smoother, and help us to find the joy in the journey. It's difficult, and we know that you're on the road with us, and we ask for your blessings. In thy name we pray. Amen. Thank you.
Thank you, Sharon, so very much. As Sharon mentioned, we are going to be sending out the program to you later today. We're going to send that to you electronically. As you know, the winter storm has put all of us a little bit behind in our projects, and so we were able to finally get that finished, and we're going to be sending that to you. It has a great wealth of information in it, not only the bios for all of our speakers, but information from all of our sponsors. We're also going to be sending you some caregiver resources, electronic electronically so that you have those, because we want to make sure that you are as well armed as possible for this caregiving journey. It's also my pleasure to welcome Natalie Harris. She is with Cindy Cummings Realty with Turnkey Transitions and Cummings Home Team, and they are our sponsor for the whole conference this year. And so, Natalie, I will let you tell us about the Cummings Home Team and the Turnkey Transitions.
Thank you so much, Rob, and good morning to everybody. Again, my name is Natalie Harris, and I am representing the Cummings Home Team. I work for them. I work for Cindy. And yeah, so thank you for joining us, and thank you for having us as the sponsor for this year's event. So I'm just going to go ahead and read a little bit and tell you about Turnkey Transitions and what we do. So many companies describe themselves as being a family, having a family atmosphere, or treating each other as family members. Well, the members of the Cummings Home Team at Realty Austin are literally a family. There are 3 family members who are on the team, including Cindy, her husband David, and son Cameron. They have accumulated over 40 years of real estate experience in a wide variety of capacities in service to real estate clients and their families. In 2013, Cindy decided to concentrate on her passion for serving senior citizens during times of transition. Recently, she created a unique added service that she offers to her sellers. It is a concierge moving experience called Turnkey Transitions. It provides her clients and their families with not only an MLS listing and top-tier marketing, but invaluable hands-on help with arduous, daunting tasks such as sorting, selling off, staging, moving out, moving in, and finally setting up of the client's new home. This unique service is, by the way, also available to any client who doesn't want to lift a finger when they move, regardless of their stage of life. Cindy is a licensed real estate broker, and she serves both buyers and sellers in all price ranges and in all stages of life. Selling a home, particularly a long-term residence, can be a very complex process. It's our goal to help you through each step of your transition as your one-stop shop solution for downsizing, right-sizing, and simplifying your life. We provide gentle, expert guidance to help you and your family make the right decisions without the emotional and physical stress that often comes with a complicated move. As Austin's only full-service senior move resource, we're committed to offering a turnkey experience for our clients. When you partner with us, you'll have no upfront costs, no surprises, no confusion, and an easy flat fee paid at closing. We're committed to offering our clients a true turnkey experience. That means no need to call multiple vendors to handle everything your move entails, no unknown service providers entering your home, and no stress from having to manage multiple processes all on your own. Our dedicated service not only comes with the care you would expect from a company specializing in working with elders and boomers, it alleviates strain from the adult children
on a Zoom
and
call.
allows children and parents to
But it's
retain
okay.
strong relationships throughout the move. Cindy also founded a consortium of service providers called the Austin Senior Resource Alliance to provide a one-stop shop for seniors and their families seeking services and advice from trusted specialists. These specialists include real estate and probate attorneys, in-home doctors and caregivers, auction and estate sale organizers, movers, handymen, among others. And although Cindy is a Lakeway resident, in 2015, she was appointed to the board of directors of Austin Up and is currently the president this year. In 2018, she helped to found LT Senior Services, which is a 501c nonprofit that helps to serve the needs of seniors and their families in the Lake Travis area. LT Senior Services provides monthly webinars on topics that are important as we age, from how to live to 100 to changes in Medicare for the upcoming year. We host additional events throughout the year and have an event coming up this Friday where we are hosting a free shred day. More information can be found at ltseniorservices.org. Cindy is also proud to sit on the board of directors for Drive a Senior Central Texas. So that's all about Turnkey Transitions and us, and thank you so much for having us.
Thank you so much, Natalie. And for those of you who know Cindy, you know she has been a major positive force here in Central Texas for both older adults and for family caregivers. And so we are really grateful not only for her support, but all of the amazing things that she and her team do for all of us here in the community. It's also my pleasure to introduce Paul Clark with Buckner Villas. They are our session sponsor today. And speaking of an organization that has done amazing things in our community, Buckner Villas has been here for quite a long time, serving both our older adults and the caregivers and their care partners. So Paul, tell us about Buckner Villas.
Thank you, Rob, and thank you, Sharon. Appreciate y'all allowing us to be part of your conference again this year. We're happy to be partners with you. That's right, Rob. Buckner has actually been here in Texas for over 140 years. We are a faith-based nonprofit organization. Just a very quick summary of our roots here in Texas is that we were founded in Dallas as an orphanage, actually, back in 1879 by Dr. R.C. Buckner, who found that there were still many orphans and widows from the Civil War. So he raised $27 and began building an orphanage in what is now near downtown Dallas. That grew quickly to over 400 orphans there. And so they built cottages around it for retired missionaries and pastors who became surrogate grandparents to the children. The children helped take care of them in their elder years. And there you have it. A big part about what we do as a nonprofit is that we have foster care all throughout the state and actually all over the world, as you can see on our map there. We have an adoption agency, we have a humanitarian aid center. So Buckner's a really neat organization that does a lot for a lot of people all over the world. Here in Austin, Buckner Villas has been here for over 50 years, actually. So we're certainly one of the most established senior living communities in the Austin area. And we're located in North Austin on a 25-acre campus. And we are what is commonly referred to as a CCRC. And CCRC stands for Continuum of Care Retirement Community, which for those who are not familiar, is comprised of independent living, assisted living, memory support, and skilled nursing and rehab. So a community like ours effectively covers all areas of life pertaining specifically to senior living, of course. So residents can move to our independent living, for example, when they're tired of the house and everything that comes with it, and for a more of a carefree lifestyle. And then for the what if part of life, kind of what Rob alluded to earlier, and curveballs and whatnot, we offer the healthcare options. And so residents can seamlessly transition within the same community and have all of those needs met if and when the time comes. So of course, there are variations of needs and differences between independent living and assisted living. And I know that there's oftentimes many misconceptions out there of what each one entails, what's provided in each one, the cost involved, of course, the budget, care needs, etc. So our team is certainly happy to help any way that we can. We have a very tenured staff here, actually. I myself have served at Buckner Villas for over 19 years, and many of our staff have been here even longer than I have. Recently, I added it up, actually, we have over 1,000 years of experience at this community alone. So we are happy to be a resource to anyone out there who may just have some questions, whether it's pertaining to, senior living in general. We're very familiar with the landscape of what's provided in the Austin and Central Texas areas. So even if it's not regarding our community in general, we're certainly happy to help and be a resource to anybody out there who just has questions, would like somebody to help them through that next step, that next chapter in their book, if you will, and just help any way that we can. So please feel free to reach out at any time, and we'll be happy to be a resource for all things senior living.
Wonderful. Thank you so very much, Paul. We appreciate that. Yes, Buckner Villas is really an amazing partner here in the community. And Paul, you make a great point that anytime any of us need assistance in our journey, and we all will, you know, please reach out and ask those questions, ask for the help. We often end up becoming caregivers without a lot of information on how that, what our role is, and we every day find something new that we don't know and we need to find out. And so all of the participants here this entire week are just a wealth of information and are willing to share that with caregivers. So, you know, reach out to Buckner Villas, reach out to Cummings Real Estate, to Riverbend Church, Age of Central Texas, any of us are here to help and to assist. Going to do some very quick housekeeping. I mentioned that we are recording today's session. We've recorded all of the sessions, and we're going to be posting those on YouTube, so that if for any reason today you have a tech issue and you get knocked out of the session, don't worry, you'll be able to watch that later. We're also going to be sharing with you the PowerPoints from all of our presenters, so that you'll have all of that to reference back to after this week is completed. We're going to be sending you the program hopefully later today, along with the caregiver resources. And then on Monday, we are going to send you all of the links to everything from the conference, to all of the YouTube videos, to all the PowerPoints, to all the resources, all of the information that was mentioned during the sessions. We're going to send that to you all in one big email, so you've got it in one spot and it can go back and refer to it. We're also going to send you the survey for the conference. And the survey is really very important, and we hope that you will fill it out. It'll only take you just a couple of minutes, but the information is very valuable for us, and especially for Riverbend Church, because it gives us the information to help us plan for next year's conference. We're going to ask you about what is happening in your caregiver journey right now. What are some of the issues that you are having that you would love to have a presentation specifically addressing those issues? And we will find the speakers for next year to talk about those issues. And I guarantee you, we read every single survey. So please, when you get that survey on Monday, take just a couple of minutes and complete it, because it'll help us bring even more resources and information to you in the future. Finally, right down here at the bottom of your screen, you have a chat feature. It looks like one of those comic strip thought bubbles. Click on that and it'll open up the chat box. And while Lina is doing her amazing presentation today, we want you to ask questions. She might say something that kind of sparked a thought that brings up a question. So ask those questions, because at the end of the session, we're going to have a facilitated Q&A, and we are going to answer your questions. We're going to try to answer every single question that is asked today. And if we run out of time this morning, because we are going to be cognizant of the time, we promised you that we would end at 11:30, and that's what we're going to do. If we end up still having questions that we haven't answered, don't worry. We are still going to answer your question. We are going to send you a direct email, and we will answer your question personally. But this is your opportunity to get all of those questions out and get the answers that you've been needing when it comes to what's happening in your caregiver journey. And always remember, there is never, ever any shame in asking questions and asking for help. So we hope that you'll take advantage of this opportunity, because you've got some great experts here today that can help you where you are in your journey. All right, it is my pleasure to introduce Lina Supnet-Zapata. She is an amazing wealth of information and knowledge. I've had the pleasure of knowing her for a number of years and had her speak at several of our conferences. And it's because she has more than 25 years of experience here in the healthcare industry. She was started as a community educator and area director for the hospice industry. She did that for 10 years. Where she worked with families and healthcare providers in the community, educating them and advocating for increased awareness and better understanding of issues relating to end of life. And then in 2013, she joined with her mother-in-law, Frances MIR, to oversee operations of MIR Care Consultants, and which was founded in 2004. And Lina serves as the vice president of MIR Senior Care Consultants, where she advocates for pre-planning because it's really a complex issue when you start talking about the care, long-term care for your loved ones. And she really concentrates on helping her clients and families to remain in control of all of their choices so that they can have peace of mind when it comes to their plans for their long-term care. She is very, very active in our community. She serves on the board of directors here at Age of Central Texas. She also serves on the board for the Aging Life Care Association. She's an active member of Women's Business Enterprise, Texas Guardianship Association, Dementia Friendly America, and the Austin LGBT Chamber of Commerce. Lina, we are so glad to have you with us this morning. I am so looking forward to this information about how do we plan for and how do we pay for our long-term care. So I'm going to turn it over to you.
Let me unmute. Thank you, Rob, for that wonderful introduction. And thank you, everybody out there in the virtual Zoom land for participating today. I know that we have gone through an extremely stressful, chaotic 10 days. So I'm so appreciative that you are here to attend this session. So I'm going to share my screen here for our PowerPoint and for my PowerPoint. Let's see. And let me get to, okay. Like Rob said, I will be speaking and talking to paying for long-term care. And our tagline for our company is planning now for peace of mind later. My company is a very big advocate on planning. Think that planning is essential when it comes to long-term care, making decisions in crisis situations and trying to make good decisions is not an optimal situation. So I'm constantly reminding and talking to many caregivers or those that are about to start their caregiving journey about planning. I just have to share a little disclaimer. The information here, it's not to be used for, it's not specific to anybody's circumstances. It's general information and it's for educational purposes. And so I'll just give about 10 seconds to read this just so that you are aware of our disclosure statements. Okay. So as we know, the trend for aging America is not new. It's constantly in the news. And so the number of Americans that are aging 65 or older will more than double. And then in the next 40 years, we're going to be reaching 80 million adults over the age of 65. And the number of adults ages 85 and older is the group that is needing the most help. Yet, given this information, many do not have a plan for their future or their long-term care. Setting up a long-term care just isn't about the budgeting of the expenses or funding the risk of a product like long-term care insurance. To properly plan for long-term care, savers need to decide how they want to get that care, the type of care that they want to receive, and who will provide that care. You also have to grant permission or appoint somebody that will help you implement that long-term care plan. Perhaps it's a family member or a relative to provide care, and develop a plan on how you're going to finance those costs. If you don't plan, the consequences can be dire. Long-term care for adults is often shifted to a family member who maybe didn't know that they were going to be a caregiver, and when there isn't a long-term care in place. So my encouragement is to have conversations as early as possible about how you want your care to look like. Financial duress, if you don't have the funds, it can also create long-term effects on the caregiver and in the household, which ultimately can be more expensive if you don't plan. 1 in 5 Americans are caregivers to an older relative, yet over half of all Americans do not have a long-term plan, and that's pretty startling. So I think all the experts and people that have been participating in this conference will always encourage and talk about and encourage our audience to plan and have conversations as early as possible. So Rob had mentioned it's not a matter of if, it's a matter of when you're going to need long-term care. And so this is just a statistic that 70% of people over the age of 65 will need long-term care. And that translates to 7 out of 10 people requiring long-term care. On average, women need 3.7 years of care. And actually, I was part of a study group yesterday that number has increased, and that women will need at least 5 to 7 years and then of savings for care. And then men will need 3 to 5 years. Elder care, private care is not cheap. Annual median average lifetime cost for formal long-term care is about $172,000, and that is from a age study that Genworth Insurance did. Although elder adults are living longer and they are healthier, and there's a trend to really take care of yourself, one is still subjected to dementia. And while the body remains somewhat healthy, the mind starts to deteriorate. So it's actually extending the lifespan and the longevity of our elder adults. So the question is, how will you thrive when you are older? It is something to think about. And again, planning now for peace of mind later is essential. So this is a national survey that was conducted by Genworth. And as you can see, there is on average for the national average, about a 4% increase year over year on the cost of care. And this just identifies different care services as well as living environments. So as you can see, it's very expensive, and it's not going down. It's actually, the trend is increasing. So again, it's really critical to start thinking about and planning for saving for your future care. The other study that I'm sharing with you here is this is the cost of care within a 2-year period from 2020 to 2022 for the Austin area market. And as you can see, there is definitely an increase, but we're actually higher than the national average. This is about a 6% increase for the Central Texas area. So why is the cost of care increasing? And there's a number of factors. As you can see here, labor shortage, personal protective equipment cost, employee recruitment. There's the pool of people that we're able to recruit is difficult. There's wage pressures. Oftentimes, the caregivers are not paid, or those in the facilities are not paid. So attracting them requires increasing what they're offering from a wage perspective, and then there's supply and demand. And of course, long-term care services have been on the rise. This year with the impact of COVID, it shook the industry as many care providers and long-term care communities had to take on new measures to keep not only their residents safe, but also their employees. So to address the needs of an already rapidly aging population during unprecedented health crisis with COVID-19. And then we just had another historical crisis with the ice storm last week. Home care and facilities saw a significant increase compared to last year's number as far as cost. So I would like to define what long-term care is, because oftentimes among certain industry groups, the phrase long-term care is synonymous with long-term care insurance, and it's not the same. So I wanted to make that distinction. It's worth noting because the definition of the phrase can be misleading and confusing to consumers, you, our audience. So I wanted to just define it as long-term care involves a variety of services designed to meet a person's health or personal care needs during a short or long period of time. These services help people live as independently and safely as possible when they can no longer perform everyday activities on their own. I thought that was important to share with you all. So where can you receive care? There are different areas where you can receive care, and I've listed them out here. Obviously, home, which is the majority of people want to receive care in their home. There's the adult 55 plus or the adult elder community. They are age-restricted communities, specifically for adults over the age of 55, or in some cases over the age of 62. Unlike other senior care types, active adult communities do not provide any personal care services or medical assistance. There is assisted living, and assisted living, under that umbrella, there are different types of assisted living. There's personal care homes. There are plenty of personal care homes in our area, which many people do not know about. They're in a residential area. Oftentimes they have 1 to 3 or 3 or more residents living in the home, and it is actually like you're living in your own home. It's a smaller ratio of resident to caregiver number, and it's a more intimate environment because you feel like you're actually living in your own home. There's type A facility assisted living, and those are for residents who do not require routine attendance during sleeping hours, and they're able to evacuate in case of an emergency. The other type of assisted living is the type B, and that's for residents who require staff assistance to evacuate. They're not capable of following directions in an emergency and require nighttime attendance or oversight. And then again, then I mentioned the personal care home. Then there's the adult day center. Our wonderful host, Age of Central Texas, has 2, soon to be 3 Thrive centers, which are adult day programs. We're very fortunate to have that community, that service in our Central Texas community. Buckner Villa is an example of CCRC. It's continuing care retirement communities. Or life plan communities. They're a long-term care option for elder adults who want to stay in the same place throughout the different phases of the aging process. We also have memory care, which is a form of senior living that provides intensive specialized care for people with memory issues. Many assisted livings and nursing homes have created special memory care units within their community. That are specific for dementia patients. There are also standalone memory care facilities. And then you have the nursing home, also known as the skilled nursing or long-term care communities. So I just wanted to give you a brief overview of the types of care that you can receive. But now we're going to move into how we pay for those services and living environments. So there are several ways on how to pay for your long-term care. We have out-of-pocket, we have government programs, long-term care insurance, and VA long-term care services. I'm going to go over these briefly, and because of the time that we have to drill down, there's so much information and nuggets of information that are so important. So I'm just going to go over the highlights. I do recommend that if you have any questions about any of these specific programs, I will always recommend that you consult an expert in that area, do your research, do your homework, and ask questions. So the first one is out of pocket. So as many older adults pay for care in part with their own money, that money can be derived from several sources. Some have personal savings, you have pension, Social Security, retirement, 401k, return on investments from stock and bond investments, or proceeds from the sale of a home. Paying for long-term care out of pocket means that you have more freedom to choose your care. But in doing so, you have to identify how long those savings will last and what happens if you run out. Again, most home-based care is paid for out of personal funds. Initially, you can kind of piecemeal your care in the home environment because you have friends and family. Perhaps you're still you still have the ability to drive and get around. But as a person's needs increase, additional paid services may be needed because perhaps family or relatives or your village may only be able to do so much, and your care requires more. So many older adults also pay out of pocket to participate in adult day service programs. Like I said, the Thrive Center has wonderful day programs on a sliding scale. They provide meals and do med management and have activities. And there are other community-based services provided by local governments. Churches like Riverbend will hopefully have their respite program coming up, and nonprofit groups. These services all help someone to remain in their home. So another out-of-pocket way to pay for long-term care is a reverse mortgage. Now, I am not well versed in this. I have many clients that have taken this route. And again, it's very important to consult with a professional when it comes to reverse mortgage loans. A reverse mortgage is a type of loan that allows homeowners who are 62 and older to borrow against the accrued equity in their homes. They can actually help some older homeowners meet the financial needs of their retirement or care. But there are things that you need to know from as a consumer, and it's just FYI knowledge that I think is very important. If the reverse mortgage is in the name of only one spouse, you need to be informed or make a plan for the non-borrowing spouse. If the reverse mortgage is in the name of only one spouse, you should be very well versed on the agreement and the information that is part of the loan, because if the loan that is in the spouse's name and that spouse passes away, what's going to happen if that loan comes due? It's also really important that you talk to your children, your heirs, or whoever is handling your or working with you to manage your financial affairs, that you talk to them about your plan and that you actually have a reverse mortgage. I've had two clients actually in my 8 years that never told their children, and they were surprised that the loan came due. So it's just really important that you have that conversation so that your family is also set up with the understanding and can set up for success for the surviving spouse. So the reverse mortgage, again, allows you to borrow against the home equity. You can live there as long as you need to, no mortgage payments to make, and the loan is repaid either when the homeowner has passed away or the home is vacated. So other ways to pay for out of pocket that are really, again, need to be directed, the specific questions, to a reputable professional are life insurance policies for long-term care, annuities, and trusts. So I'll just go over briefly each one of these. Some life insurance policies can help pay for long-term care because they offer a combination of products of both life insurance and long-term care insurance. Annuities you can enter into an annuity contract with an insurance company to help pay for long-term care services. So in exchange for a single payment or a series of payment, the insurance company will send you an annuity, which is a series of regular payments over a specific period of time. This is can be very complicated, so it's really important that you consult a financial professional. And then there's a trust, which is the legal entity that allows a person to transfer all of their assets to another person called the trustee. Once the trust is established, the trustee manages and controls the assets for the person or the beneficiary. You can choose the trust to be as flexible as needed and to pay for long-term care or any other needs that the person may need. Oftentimes, financial institutions offer or have a trust department. Again, it's really important to do your homework because there is an administrative fee, often a percentage of the total of the monies that you're putting into the trust. It is also very important that that you know the trust officer or the person that is overseeing the trust, because when you need something, you need to be sure that that trustee is going to allocate the funds when you need it. There are also fees to manage the trust and then a minimum dollar amount to open the trust account. And that varies from financial institution to financial institution. So the next area is the government programs. And I wanted to make a distinction here because over my years in healthcare, Medicare and Medicaid still get confused. And it is because they sound similar. Medicare and Medicaid are US government sponsored programs designed to help cover healthcare costs for US citizens. It was established in 1965 and funded by taxpayers. They do have similar sounding names. So I put some references here. Medicare, if you are a Medicare recipient, you will have this red and white and blue card. Okay, that used to have your social security number. Now they changed it to actually have a jumble of numbers and letters, which is great because I always thought that it was a little concerning that somebody's social security number was on their Medicare card. So Medicare is the primary medical coverage provider for seniors and those with a disability. Medicaid is designed for people with limited income and often pays for long-term care in a nursing facility. So Medicare has 4 parts that each cover different things. And those 4 are hospitalizations, medically necessary services such as hospice or skilled nursing in the home, supplemental coverage, and prescription drugs. The CARES Act extended the ability of Medicare and Medicaid due to COVID-19, and that is still ongoing. So Medicare, and what does it pay for? It pays the cost after 3 hospitalizations, which is actually 3 midnights. It will pay full cost of skilled nursing in the nursing home, which is also called a SNF, SNF. That's the acronym, Skilled Nursing Facility, from day 1 through 20. It pays partially from day 21 to 100. And there is a co-insurance payment, and that's $148.50. That is the new rate for 2021. So if you have a supplemental insurance, it will pick that up. But if not, it's the responsibility of the family to pay that $158.50 per day. It pays nothing after day 100. It's often misunderstood that Medicare will pay for custodial care, but it does not. It does not pay for any personal home care or custodial care. And the home health benefits are limited. So perhaps some of you have had home health in the home. It is only for a certain period of time. There are some criteria to receiving that benefit in the home, but typically it is for a certain period of time. You may be eligible for a recertification to extend, but it is never an ongoing benefit for recipients. The next program is the Medicaid program, and it is the largest payer of long-term care services in Texas. It is means-based, and Medicaid limits where you can receive care. Medicaid is a joint federal and state program that helps low-income Americans of all ages to pay for the costs associated with medical and long-term custodial care. It has a strict eligibility requirement, and it varies from state to state. So what happens here may not be the same in Florida. For example, I know that some assisted living care in the state of Florida is covered by Medicaid, but in Texas, it does not cover long-term care. Each state establishes its own eligibility criteria under the federal guidelines. And in most states, an individual's income must be less than the cost of care. In some states, like Texas, an income cap applies. And there are instances where there are some assets that are not counted. And again, it's very important that you either call the Texas Department of Health and Human Services or consult a legal professional. But I do know this, that the countable asset, for example, your house, if your spouse is living in the house, it can possibly not be counted. Household and personal belongings, term life insurance, burial plots and funeral expenses also may be excluded from the countable assets. So it's really important that you consult and make sure that what is being included or not. There is also a look back period. So I've had people approach me and ask me, I'm exceeding the limit, so I'd like to just give it away. And you can't do that. Medicaid will look at it, and there is a 5-year period of time that they're going to look back and see when that money was allocated. So you can't just give it away in order to meet criteria. And I'll actually put the resources for who to contact at the end of my presentation. So long-term care insurance. Long-term care insurance covers many types of long care and benefits. The exact coverage and the type of policy you buy and what services are covered depends on who you're buying from and what you want as part of your policy. You can purchase nursing home coverage only, or a comprehensive policy that includes both home care and facility care. But it's very important to choose your benefits and your features wisely, because there is a cost associated with that. There are a lot of companies out there that sell long-term care insurance. So my recommendation is, of course, to do your due diligence, shop around, compare policies, talk to somebody that's a trusted professional that is very well versed in the long-term care insurance field. Again, the cost of the policy is based on the amount of services, how old you are when you buy the policies, and any pre-existing conditions that you have, and the options that you put with, that you choose to purchase for yourself. Ideally, long-term care insurance can be a good choice for somebody that's younger, you're relatively healthy, and you're at low risk for needing long-term care. Costs go up, of course, when people are older, you have health problems, and you want more benefits. Someone who is in poor health, perhaps that is on hospice or end-of-life services, may not need a long-term care insurance benefit. So some of the things that I've learned along the way as being a daughter and a caregiver, first from my father, who passed away 4 years ago, and currently for my mom, who they both purchased long-term care insurance. But I will tell you, it was a learning experience for me because it's easy now, but it wasn't back then. So I encourage you, if your parents do have a policy, if you have a policy, that you're talking about how to initiate that policy. It's really important. Of course, with long-term care insurance, you have the freedom to choose, but you know that there's an elimination period oftentimes. I'm not saying that it's, you know, across the board, but more often than not, there is an elimination period. And what that means is that you will have to pay out of pocket for whatever the policy designates. For mine, it was 90 days. So I needed to pay 90 days out of pocket for my mom's long-term care. And then on that, on the 91st day, the benefits started. Understanding how to initiate the claim. What are the requirements? Usually it's 2 or 3 needs of activities of daily living that you need assistance with. So whether that's bathing, eating, standby assistant, those are indicators oftentimes. Now, again, that's not across the board, but for my own personal journey, my mom had to meet 2 out of the 5. And then where can you receive or who will accept the long-term care reimbursement? Most assisted livings, long-term care communities do, but it's really good to check with the business office to see what the process is. Oftentimes you can have the payment directed directly to the long-term care community, or you pay out of pocket and then they reimburse you for whatever the benefit amount is. Long-term care insurance, obviously, because they are paying a benefit that you've paid into, can help preserve your cash reserve. Again, it's really important to shop and compare policies and talk to somebody that's a trusted professional that will give you good information, accurate information, and most importantly, understand what it is that you're purchasing and how to utilize it. Okay, the last one that I'm going to talk about is the Veterans Aid and Attendance. There are millions of veterans out across the United States, but it was interesting that there's a very low number of veterans that apply for the VA Aid and Attendance or the VA pension program. So the VA helps U.S. veterans and their families by providing supplemental income through the Veterans Pension and Survivors Pension Benefit Program. The pensions are available to U.S. military veterans and widowed spouses of veterans. Pension benefits are needs-based, and your countable family income must fall below the yearly limit set by Congress. So that changes every year. So in order to apply for the VA Aid and Attendance, you first have to apply for the VA pension, the basic pension program. So to meet the disability requirement, a veteran must meet one of the following conditions. And again, this is for the basic pension. You just have to meet one. It has to be a minimum. You need to be a minimum of 65 years old. You have a permanent or very little chance of recovering from the disability. And a total 100% disability rating, non-service connected disability. You need to reside in a nursing home facility due to a disability and require long-term care, and be a recipient of a disability benefit from Social Security. Now, you just need to meet one of those criteria. So once you're accepted into the basic pension program, then you are eligible to apply for the Aid and Attendance pension program. So a veteran or surviving spouse cannot be eligible for the Aid and Attendance pension program without being eligible for the basic veterans pension. These are the requirements for the Aid and Attendance pension program. The veteran or his surviving spouse must meet just one of these requirements. Need assistance with ADLs, and ADL stands for Activities of Daily Living. And those are bathing, grooming, dressing, eating, and mobility. So if you need assistance with that, then you have met the criteria. You must, you either have to be bedridden or confined to the bed. be a resident of a nursing home facility due to the inability to function physically or mentally, and have profound vision impairment. So I've listed those. Those are the 5 criteria, but you just need to meet one. In addition to the completed application, and this is often the frustrating piece and perhaps why there's such a low number of veterans or their family members applying, because besides the specific information for the basic pension program, there's a lot of documentation that needs to be acquired, and it can be very overwhelming and daunting. For example, some of the documentation required are bank statements, marriage certificate, military discharge papers, receipts for unreimbursed medical expenses. You need a physician statement, disability statement. So there's so much that needs to be acquired that it can be overwhelming, and maybe folks give up. So the application and approval process, in addition to the aid and to applying for the basic pension, it can also be slow. So not only is the acquisition of information overwhelming, but it can be relatively slow, on average from 9 months to a year to complete. The approval process is anywhere from 9 months to a year. So add that on top of trying to acquire all of this information, you can see why it can be overwhelming. But 2 good things is anyone that's over the age of 90 can request an expedited review. And then while the approval process takes a long time, it pays retroactively upon approval of the eligibility. So this means the first benefit payment will include a lump sum to cover the months that the application was pending. So there is light at the end of the process, but it does take some diligence and hard work and time to get all of the information together. So strategizing for your long-term care, I go back to the beginning about the importance of planning now for peace of mind later. And how do you strategize? And these are some things, important points to think about. What does your financial health look like? Where are your assets? Where are they located? How much, what is the return on your investments? And kind of costing that out for, like I said, the 5 to 7 years earlier in my presentation, that's what you're going, on average, that's what women are going to need in their later years. What does your physical health look like? Do you have pre-existing conditions? Do you have chronic disease? How are you taking care of yourself? Is a possible indicator on how the longevity and your life expectancy. What are your options? Where do you want to live? What do you want your care to look like? You are in control right now to make those decisions. So it's really important that you define and you say how you want things to look like. Do you have a circle of care around you? Do you have family that's close by? Do you have friends, relatives who are willing to help? And again, it's not a good idea to take them off guard. So having these conversations are difficult, yes, but in the long run will be very helpful to not only you, but to them. Consult with a professional team, attorney, financial planner, certified care manager, which are licensed LMSWs, medical social workers, RNs, trust officers. There are a lot of people who have presented to you today that are professionals that have a wealth of information. You have nonprofit resources, the Age of Central Texas, the Area Agency on Aging. I think that there's a lot of people out there that are so willing to help and have a wealth of resources that you could draw on any one of the presenters, I'm confident, and ask for help, and they would be able to direct you to the right individual. It's really important to designate your power of attorneys and create your advance directives. I know this is another difficult conversation. Sometimes parents don't want to talk to their children about it. Advance directives, it's like, oh, that's like that you're sealing someone's fate. But if you don't have those in place, I've seen the difficult side of that when family members need to make a decision on behalf of their loved one and they're not able to because those documents are not in place. There are legal services out there that are of no cost, that you could get guidance on initiating these advanced directives. There are medical social workers that can help put that together, and specifically a do not resuscitate if that's your wishes. But I can't tell you enough how important it is to put your medical and your financial power of attorneys together and have a conversation with those people that you have designated. Also, when selecting a power of attorney, it's important that that person can execute on the wishes that you have put forth in those powers of attorney. So why beginning planning today? So if you're healthy enough, you can actually take advantage of all the options that are available to you. You have the luxury to look at different options that are available to you. It's also to relieve your family of the burden of making the decisions in your healthcare and your financial decisions. And I want to take a moment to share that it is a great gift if you are able to have the conversation with your family. And I'm sorry, because I've seen a lot of families go through so much this last couple of days. It's been really hard, a lot of loss, and a lot of people that have become sick because of the results of being in freezing cold weather. But it is a great gift to be able to give your family some peace of mind, not only for the generation of your kids, but your grandchildren and your great-grandchildren. Oftentimes when those decisions and that conversation hasn't happened, you haven't put those plans into place. And many of you know what I'm talking about, is there's turmoil, there's chaos, there's fighting. And when somebody's sick, you're grieving and it's hard to think straight. So, and sometimes words are said and emotions fly, and sometimes those can't be taken back and they cannot be undone. So it's good for everybody to be on the same page. Look at it as giving a gift to your family to have these conversations, so that despite the stressful emotional journey that you all are on, at least you have some clarity in the direction that you want to go. You have time to explore services and costs, and that's essential. And you are able to assess what your finances are. Again, it's not optimal to decide when you're in a crisis situation. So I ask that, what are you doing or not doing today to discuss finances and identify resources and care for you, your family, and what your long-term care is going to look like. So this will be in the PowerPoint PDF that Rob will be sending out and will be available to all of you on the online platform. Just go over this really quickly. This is resources for Medicare.gov. You can actually go to the Medicare website and compare different long-term skilled nursing facilities. It will show their surveys. It will show their good features and their good care. Now, I will caution you that oftentimes it's about one year to 18 months behind. So what happened during that survey could definitely be different because it's not in real time. For Medicaid information, you can go to www.benefits.gov. Of course, we have the Age of Central Texas, which are so blessed to have the Thrive Centers and all the supportive services that they provide. The National Association of Elder Law Attorneys, you can go to their database and look for an elder law attorney if you're able to do so. Just put in the city and the mile radius, and it'll give you a list of elder law attorneys in our area. Area Agency on Aging, websites there, va.gov for veteran benefits information. I am a certified aging life care manager. We are a national association of over 3,000 care managers. And so you can find us the same way you would find an elder law attorney. Just type in the city and the radius, and it will give you a list of certified aging life care managers. And then, of course, our host with Riverbend Church, I did not include them here because I just heard that they do have a support group, and they will be offering in the near future a respite program. So that's really wonderful. So I really appreciate it. Thank you so much for listening to my presentation. I'd be happy to take any questions.
Thank you so very much, Lina. We really appreciate all that information. You know, we unpacked a whole lot here today. So let's take some questions. And if you don't mind unsharing your screen real quick. We've got quite a few questions. Some of them are kind of specific. We may not be able to answer them exactly, but we can certainly talk about them. We talked about utilizing a trust or an annuity. And a fairly simple question is, who should you go to get advice on a trust or annuity? Is that something you should talk with an attorney, with a financial planner? Where would you start exploring if you could benefit from a trust or an annuity?
So I work with a lot of trust officers and financial institutions, and there are several banks in town that have a trust department. So you can call your bank and ask them if they have a trust department, and that would be a good start to reach out. If you have a financial planner, most of them they know trust officers, so that would also be a good starting point.
That's great. And if you're not sure where to start looking for a lot of these things, Age of Central Texas has a resource center, so you can contact us directly and we can help point you in the right direction. Lina also mentioned the Area Agency on Aging. They have a wonderful resource center as well. And so those are two places that are nonprofits that don't have any skin in the game when it comes to this. And so we can make recommendations based specific on your needs, because we know a lot of the folks in the area that would be able to help you with those. Another thing that we were talking about was about insurance specifically, and we've had some questions about people's specific benefits on their insurance plans. I think our recommendation is to go back to the person that you bought your insurance from and ask about, what's on my policy? What am I going to get? What am I not going to get?
Yeah.
And also, the Area Agency on Aging does have benefits counselors. And so they can help you with not only your current policies that you have, but specifically they can help you walk through your Medicare, Medicaid, and veterans benefits if those are something that applies for you as well. So they can help you with those. We had a question about Ladybird Deed and what that is and how that can help with either the reverse mortgage or looking at what happens to the property of the home.
So I would consult with an elder law attorney, because I don't want to misspeak on the particulars. Every situation is different when you're talking about protection of assets, and also to meet, Medicaid eligibility. And so it's a very delicate and it's specific to someone's circumstance. So if you look at NALA.org, which I had made the reference to, I don't know if Triple Area Agency on Aging might have an area or someone that could help kind of give more detail to that.
Yeah, and also if you have an elder law attorney or a financial planner, those are folks you need to talk to about this as well. In essence, a Ladybird Deed is something that's very specific to Texas, that it can help protect your property, that you are basically putting your property in trust to an heir. And so again, it's something that you would need to do with your lawyer or with your financial planner. So that's something to look at. It's a fairly simple process, and you can just Google Ladybird Deed, and the state of Texas will tell you exactly what it is. But it's not a very difficult. It's just a one form you fill out and sign.
I think it's also really important that, when you're talking about protection of assets and, doing it the right way, because there's a risk that, we don't want anyone to lose their house. So it's really important to consult a professional that can look at your overall financial picture and make comment and recommendations to that.
Right. And of course, everybody's situation is different. And
Mhm.
so, as Lina noted at the very beginning, we're talking in very broad terms here. And so it's not a one size that's going to fit all, but it's always, always important that you talk to a professional about your situation, because you may have some special circumstances that are more beneficial to you that you
Yeah.
didn't know about, and that they can help you out with those. I've got several questions about long-term care insurance. Specifically, when you already have long-term care insurance and you initiate it, is it possible to start and stop again? To stop and start again? Or once the claim is initiated on long-term care insurance, is it you just can only use it that one full time?
I think that might be specific to the policy.
Okay.
What the rules are, and then again, you may not know your agent. You may have bought that long-term care insurance years ago. So call the company that is the holder of your policy and ask about that specific question. Yeah.
And also a question in reference to long-term care insurance and hospice care. We had Austin Hospice as our sponsor yesterday, and we were talking about that they, as a nonprofit, there is no cost for the hospice services that they provide. But a lot of time those services are going to take place within either the assisted living or the memory care or the hospital situation. So the hospice care is not going to pay for the cost of the room and the cost of the services with the assisted living, hospital, et cetera. It's just going to pay for the hospice care itself. Is that correct?
Yes.
And
And typically, I was under the assumption that most people that are on hospice are Medicare recipients, and Medicare covers, equipment, supplies, medications related to the hospice diagnosis at 100%. So I often think that it's misleading sometimes when they say they're going to pay for the hospice care, because it's already covered by Medicare if you're a Medicare recipient.
right. But if you're not
Right.
and you're utilizing it, then for like the hospital room cost, the cost from the hospital, those things are going to come either out of your long-term care insurance, out of pocket, or other insurances that you have.
And there are actually 4 levels of care under the hospice benefit. So respite, inpatient hospice, and where hospice will actually pay for a small period of time to pay for an inpatient stay. But once the crisis is alleviated, then they will return the resident back to their living environment. So it's always good to ask about what, the hospice agency, if you're utilizing a hospice agency, what levels of care they provide, because there's 4 that are covered under Medicare.
Right. And also had a question, and if you have encountered this with any of your clients where they had bought their long-term care insurance a long time ago and find out that the company that they bought it from is now in receivership, and is, what do I do with my policy now? I know the state of Texas protects consumers, that if their insurance does go into receivership, that the state of Texas will still honor the policy. But have you had any experience with that, where someone's insurance is no longer valid because the company went down?
I have not, and I'm so sorry that has happened. But if you haven't called the Texas Department of Insurance, certainly that would be the first call. I do. If we could take that person's information, because I do have a whole pamphlet on what happens if, that I can share. So.
Great. Yeah. So I had mentioned that if we were not able to get through all of the questions, that we would answer people individually. For some of these very specific questions, we're also going to answer you individually as well, because we know that people have some very specific circumstances that are unique to them. And so we'll see what we can do to help you with those. But again, both Age of Central Texas and the Area Agency on Aging of Capital Area both have fantastic resource centers. So you can call, email, contact us online, and we can help you individually with the needs that you have there. Another question about long-term care insurance, and I think this would relate with the power of attorney. If you are the care partner for the parent, but as the sibling, you're not the one with the power of attorney, how can you find out what mom, dad have in terms of their do not resuscitate paperwork, or if they, how do I contact the long-term care insurance? Because I'm the one here, and brother who lives in California is the one who had the power of attorney 20 something years ago, but he's not here and I need it now. How do we find out those items?
So it is really like Fort Knox, unfortunately, trying to access information. And again, this just goes back to, the conversation. But for your particular instance, I would call the long-term care insurance company and I would ask them what they would accept as part of. Now, if your brother is the power of attorney, can he give you permission to access the information? I went through this and I had to send power of attorney and paperwork like 5 times because they could never find it. So I would find out if they have a specific form that needs to be filled out with authorized representatives to speak on behalf of your parents to initiate or inquire about the claim. Or if your brother is the designated power of attorney, would they accept him giving permission to you to access that information?
Right. And, we talked about having those conversations and why it is so important. And, our recent weather situation really brought a lot of our family members closer together because we were checking on each other quite frequently to make sure we were okay. Maybe now the door is open. It's a good time to have those conversations. Lina, you've had these experiences both with your family, with your clients. I've had them with my family. I think all of us who are on this Zoom this morning know of, if it hasn't happened to them, it's happened to their family members, that emergencies happen at the most inopportune times and you end up at the hospital with no information, no paperwork, don't know what to do. It's so much better to have those conversations in advance so that you're prepared and ready to go. And especially as a caregiver, to make sure that you know where all of those pieces are. We're going to be doing our caregiver training camp next month. And Lina, you'll be speaking at that. You're going to be talking about medical management, but part of that is you talk about having your folder together and having your binder. And can you touch on that for caregivers on making sure that you've got all of your information in one spot so you know when to grab and go?
Sure. So, and this is again, just out of my own caregiving journey, intuitively, and it's also because it's what I do for a living. But, we had so many instances where my father had to go to the hospital, and also because there were caregivers while I was not there, they needed to know what to do and who to call. And so, and it's not an invention of mine, but it's probably a 3rd, 4th generation of ideas that somebody had shared with me long ago in my career. But it's a binder that has a wealth of information that are pertinent, and it's usually the same questions that somebody will ask over and over again, whether that's a hospital admission, EMS coming to the house, home health, caregivers, doing their care plan, long-term care insurance assessment. They're going to ask you for the medication list. They're going to ask you, do you have any recent medical records? They're going to ask you, do you have a DNR, medical power of attorney, durable power of attorney? So, and not the originals, please, just the copies, but putting family contacts, even pharmacy information, hospital of choice. I like to put, like what my dad liked to eat when, he couldn't eat. Some of those things, and music that he liked, some of the psychosocial background of a loved one, so that they're just not a patient, but they're also human too. So putting that all in the binder to have, but it's also the grab and go. The other thing that I've learned during this time is, because there's been so many hospitalizations that are unexpected, is to have, when you're having a baby, you put a bag together, have a bag together to get to the hospital. Chargers, photos, extra extra clothing, personal care items. I think that binder plus that bag to go, because many of our, not many, but several of our clients had to go to the emergency room with what they had on and admitted to the hospital. And guess what? Family could not take them anything because they were prohibited from going. So it's been a learning experience, but I think the addition to the recommendations, if you have an emergency, is that binder and that to-go bag.
Those are both really smart things. And I really like the idea of including some of the personal about the person in your binder so that you can share that with the hospital. Because like you said, you know, we've got a new normal now when it comes to the hospital. We can't just stay with our loved one in the room like we used to be able to. And provide a lot of that information to the floor nurse, the charge nurse, and the doctors that are coming in. So being able to have that information that can be provided to the whole care team and that they can share it internally makes the outcome so much better for your loved one. We've talked a lot about the do not resuscitate and have a question specifically to that, which is, if a person is on hospice and a DNR is honored, what about when someone is not on hospice and either in the hospital or at home and they pass? Is the DNR still supposed to be honored? Or let's say, example, the EMS comes. And so because we've got so many different players here who are dealing with the patient, with the loved one, how do we ensure that the DNR is honored through all of those steps?
So, well, first having one, and then accessibility. So there's a difference between an out-of-hospital DNR and an in-hospital DNR. So when you're in the hospital, the doctor will write an order for an in-hospital DNR. Outside of the hospital walls, a DNR should always be honored, but it also has to be accessible. A lot of people in the misunderstanding is, I have an advance directive, but it could be a directive to physicians. That's not acceptable. In the state of Texas, there's a specific form, a DNR, and you can go online and obtain one printed out. And it has a little state of Texas in the left-hand corner. That's how you know that it's the DNR. Now, EMS will not recognize any other form except that DNR if there's a resuscitation order. So if they can't find it, if they can't see it, if they have to look through a binder, they are going to, and they say, oh no, we have a DNR. They're not going to say, well, we're gonna look for it. They're going to do the chest compressions and resuscitate, try to attempt to resuscitate the patient. So when I talk about first of all, having one, accessibility. I recommend to my clients have one on the refrigerator or close to the bedroom door, or on the back of the front door in a plastic sleeve. Some people put it in the refrigerator or freezer. I don't know why. And then have one on your person and have one in the glove compartment of the car. Those are my main recommendations, and make sure that whoever is the medical power of attorney or in your circle of care, that they know where it is and that they have access to it. And the one place that you can always defer to is the binder. The binder could have it in the front sleeve of or the cover of the binder.
Now, you can never be over prepared.
Right.
These types of things. And you talk about the binder, and someone made a very good point here in our chat, and that is to, if your loved one has had their COVID vaccines, include that vaccine card in the binder so that can go with you to any emergency situations.
Yeah, thanks, Karen. That it's new normal. It's like, oh yes, I'm gonna put that in the binder. Thank you.
And Karen also said that the reason for putting the documents in the fridge or the freezers are protected from fire.
Okay, thank you.
Which is a smart idea. And I know that in some of the communities, the emergency, especially in rural areas like in rural Williamson County EMS has advocated for putting your documentation in the freezer, because that's where EMS is going to look. Okay. If there's not someone there who can say, here it is, if they have to go to mom's house and mom is there by herself, that's one of the places they're going to look. So they're trying to kind of standardize a little bit for the EMS services. Good to know. But that's a great point. I had never thought about.
We've been doing this a long time. We always learn something new.
Yeah, I had never thought about the fact that the refrigerator is not going to burn down. So that's a great place to store things. wanted to also ask a question about the DNR. So a lot of what we've been talking about is if mom, dad, husband, and wife either are staying with us as the caregiver or they're living independently, we're taking care of them. If mom, dad, husband, and wife are in assisted living memory care facility, we've when we move in there, the facility is going to have us do a lot of paperwork. They're going to have us do the DNR and the power of attorney and all that. So they have it on file. What happens though when we're not there? EMS has to come to the facility to pick up mom, dad, husband, wife. Is there a chain where the paperwork will go with the person, or are we going to have to follow up as the caregiver to make sure that the hospital has it?
Well, I lived through that situation with my mom, and the paperwork did not go with her. She wasn't in a dire situation. It was for an infection, but the paperwork did not go with her, and so it's really important that you follow up to make sure that they have everything. I have a little bit of a different situation. My mom doesn't speak English anymore. She's lost the ability to speak English. So she could not articulate any of that. And then we couldn't find her. They sent her to, they rerouted her to another hospital. So it was and of course I was out of town. So, yes, so I would just follow up with the emergency room, because that's where the first place that they're going to go. But again, it's really important that you also have that paperwork, because if it didn't make it, and there maybe perhaps in the time that she goes that there was a new medication introduced and that was contributing, you have to know that. You also have to be an advocate regardless of where your loved one is, and you got to be in the know. So luckily, just by nature of what I do, I had all of that information and was able to communicate that to the emergency providers. But it's really important, again, to extract that information and have it and be able to speak to it, or at least send the information, because in this particular situation, the paperwork didn't go with her.
Right. And just going to loop back around, we're talking, since our discussion day is about how do we pay for all of this long-term care. I think one thing that we should touch on is that you don't have to look at one single payer source for all of this. It's not all eggs in one basket. So you may be utilizing a combination of Medicare or Medicaid, veterans benefits, long-term care insurance, the assets that you have like 401k, or the assets in the property, money that you have saved. So it's not that you have to look at just one spot of how am I going to pay for this over the long term of 5-7 years. Mm-hmm. That you need to think long term, long game. And again, like we said, talk with one of those financial experts who can take a look at everything that you have and help you come up with a game plan on how we're going to do this for long term. Would you agree with that?
Yes. Yeah. It's a hybrid of how you're going to pay for things. Yes. It's not a one all or nothing. So it is a combination, but most importantly is how you're going to conserve those assets with some benefits that you may be eligible for, which can subsidize your long-term care, and also to be knowledgeable and just take advantage of that. It's a benefit that you've earned, especially with Medicare. And if you're a veteran, obviously you've earned that right to have that benefit. So it's worth looking into, and it will always, it will be a hybrid approach to personal savings and investments and return on the investment, and then the benefit programs that you are eligible for.
Wonderful. Yeah, we'll be honest, long-term care is very expensive here in the United States, unfortunately. And unfortunately, it's something that every single one of us and every single one of our loved ones is going to need. And like we said, it's not going to be the if, it is the when. Mm-hmm. And it's something that we have got to plan for, because it's going to come to us at some point in our lives. And if we're not prepared for it, it can be financially, emotionally, spiritually devastating, not mm-hmm. only to us as the immediate family, but to the person that that we love and that's being cared for. And so we know it's a hard conversation to have anytime you're talking about end of life things. It's very difficult to bring up that subject, but it's a conversation that has to happen. And there are multiple opportunities for finding ways of paying for this long-term care. As we just noted, it's not everything has to come out of one source. I love that word hybrid, the hybrid of resources to help make it through. And Lina, as you pointed out at the beginning of all of this, because we're all living so much longer, we're going to need a longer amount of care than we did, say, even 20 years ago. And so we need to plan for that long game. And so, Lina, I thank you so very much for sharing all of this information. As we noted, we're going to send you the PDFs of the PowerPoint so that you have all of that information. But if you have specific questions about your situation, your parents' situation, or most importantly, to plan for yourself so that your kids don't have to go through all of the issues later on, be sure and talk to the experts. Talk to an attorney, specifically an elder law attorney. Talk to a financial planner. Talk to your bank. Start there. You know, they have your finances. Start there with the bank. Talk to the folks who have your mortgage if you still have a mortgage, of what happens if something happens with me. Just start making those plans, because it's something that's going to happen. It's so much better to have a game plan going in. And as Lina noted, if you are caregiving, then make sure that you've got your binder with all the information that you need for your loved ones, so that in the event of emergency, you can just grab it and go, and you don't have to worry about where everything is. You have it in your hands and you're ready. We appreciate you so very much joining us today. We want to thank Lina so very much for unpacking all of this information. This is a very complicated scenario to discuss, but Lina, you did a beautiful job of explaining it. We thank you so, so much. Thank you so much to the Cummings Home team being our sponsor for this whole conference, for Buckner Villas for sponsoring today's presentation. On behalf of Age of Central Texas and Riverbend Church, who for 8 years has brought this amazing conference to you, we thank you for joining us. We hope you join us tomorrow for our final session. We're going to talk specifically about caregiving. And we have AARP Texas joining us to talk about how do we live through all of this craziness that's happened over the past year and our last week that added the cherry on top of the sundae. So we thank you for joining us. We hope that you have a wonderful rest of your day, and we will see you tomorrow morning at 10 o'clock. Thank you and goodbye.